If we just repeal the bill as suggested by Senator McConnell, the consequences of that action, I think, will be very damaging to the seniors in Maryland and around the nation. And let me tell you why. The bill that we enacted last year started to deal with the gap in coverage for prescription drugs. Seniors last year received $250. This gap, if you spend a couple $1,000s on prescription medicines, you then have to pay 100% of the costs of your prescription medicines under current law. Until you spend another couple thousand. For many seniors, they can't afford that. It means either doing without prescriptions or cutting pills in half, compromising their own health care. I've gotten many letters from people in Maryland telling me, from seniors who've said, look, I've had to leave a prescription on the counter because I couldn't afford it. And I got Medicare, and I got coverage under Medicare D, but I couldn't afford it because I fell within the coverage gap. Do something about it. It's not fair. Taking medicines keep me healthier, and I should be able to get that coverage here in the wealthiest nation in the world. Well, we did something about it last year, and the repeal would eliminate that protection. We're going to close totally that coverage gap, that so-called donut hole. And this year, 2011, the benefits are going to be worth about $500 to the seniors who fall within that coverage gap. That would be lost if the McConnell Amendment were adopted and became law. We can't let that happen. I'm going to tell you, next year it'll even be a better benefit. I think it gets up to about $2,400 of benefits to our seniors. That would be lost if we were to repeal the bill. But it goes beyond that. We now are providing a wellness exam every year to our seniors. They'll be able to get covered for their preventive health care. They don't have that today. We expand their benefits. We guarantee that their benefits will be provided, but we go beyond that. We eliminate a lot of the co-payments on preventive health care. We make the program stronger, increasing the benefits for our seniors. And at the same time, we do something which is extremely important. We make the program safer for tomorrow. We extend the solvency of the Medicare Trust Fund for a decade. That's what we did last year. If we repeal the bill, if the McConnell Amendment became law, the Medicare system would be on much weaker ground. If the McConnell Amendment were to become law, that would be lost. You truly would be at the mercy of your private insurance companies. How many constituents have we heard from who've told us the examples of the insurance companies using pre-existing conditions to block their coverage? I could tell you about a family in Montgomery County, Maryland. A husband and wife and 2 children had to take out 2 insurance policies because the insurance company said that one of their children had a pre-existing condition. They had to take out 2 insurance companies, 2 insurance plans, paying 2 premiums and 2 deductibles. Well, that's outrageous. We've done away with pre-existing conditions for our children. And we're going to do away with pre-existing conditions for all Americans, as we should. You buy insurance to protect you. I was really surprised to learn of how many Americans, if they try to buy insurance today without government protection, would run into an insurance company and tell them that they have a pre-existing condition. If you have high blood pressure, even if it's under control, pre-existing condition, God forbid you should need to see a cardiologist, not covered. If you have high cholesterol, you take a pill, it's under control. You think you're in good shape because you can eat whatever food you want to, and your cholesterol numbers are still good. Not for your insurance company. That has been considered a pre-existing condition. If you're a victim of domestic violence, that's considered a pre-existing condition. Quite frankly, I think some insurance companies considered women to be a pre-existing condition, the way they wrote their policies. Well, we do away with that. And if the McConnell Amendment were to become law, all that protection that was done last year is gone. And if you think we'll be able to pass it again quickly in this Congress, come down here and watch the way Congress works. 30 years it took us to bring this bill up and to get it passed. These are protections that are critically important to families in this nation. And we need to make sure that these are protected. Caps. You buy an insurance plan and all of a sudden you find out you have annual caps and lifetime caps, and which you thought you were buying, protection against catastrophic. It's not there. We've done away with the caps. Protecting American families. That would be gone. if the McConnell Amendment were to become law. I've heard a lot of discussion on the floor here about small businesses. I tell you, one of the reasons I worked so hard for the passage of the Affordable Care Act is to help small businesses in our community. They are discriminated against. It costs a small business owner more for the same coverage for its employees as a large company. On average, it's about 20% higher for smaller companies to insure their employees. That's wrong. That's just wrong. We take steps to correct that immediately by giving small businesses a credit. We help them make it more affordable for them to cover their employees. Now, I heard my colleagues complain that premiums are going up. Yes, premiums are going up because of the current system, the one that we have changed, are in the process of changing. It's going to take some time for us to get full implementation of that law. That's understandable. It's wrong. I wish we could do more to bring it down quicker. But for this bill, the premiums would be even higher. We know that. This bill helps us to start to get a handle on helping small businesses have affordable coverage for their employees. And once again, if the McConnell Amendment were adopted, it became law, that protection, that help for small businesses would be lost. We should be working together on this bill. We should be looking at ways to improve health care in America. We never said that we completed our work last year. We know there's more work to be done. We know there's ways that we can improve health care in this country. Let's work today to do that. But let's not go backwards. Let's move forward for the American people. Let's create the jobs that we need for our economy. Let's continue to make health care accessible to more and more Americans and affordable to more and more Americans. And let's provide the quality care that's befitting this great nation to all of our citizens. I understand health care is personal to every person in this nation, and that everyone looks at how they're going to be taken care of in this health care bill, and that's the way you should. We think the overwhelming majority of Americans benefit by the bill that we passed last year. But I would hope every American wants to make sure we have no more Demandi drivers. That every person in this country has access to affordable, quality care. And that was the signature accomplishment in the last Congress. We did it in a way that helped our seniors, that helped our families, that helped small business, that helped our taxpayers, and helped America to become, at long last, a nation that said health care is a right, not a privilege. All that's lost if the McConnell Amendment were to become law. I urge my colleagues to think before they vote on this amendment as to whether you want to be on the right side of an issue that I think helps define the nation that we are. I urge my colleagues to reject the McConnell Amendment.